covering every facet of addiction here in Hamilton County, and have been for the 5 years that I've been the chair. So the prevention committee is Nicole Schischler from Prevention First and Leah Dennis Ellsworth from UMADOP. The treatment committee, John Young is the chair of the African American Engagement Work Group. Neil Tillo from Talbert House is here, and Pat Tribby with the Mental Health and Recovery Services Board is on that committee. The interdiction committee consists of Chief Tom Sinan from the Village of Newtown, District Chief Carstel Winston, Cincinnati Fire Department, and Trina Jackson with the Hamilton County Office of Reentry. The Harm Reduction Committee is Dr. Jennifer Mooney from Hamilton County Public Health, Tiffany Mattingly from the Health Collaborative, and Linda Gallagher from the Mental Health and Recovery Services Board. The Faith Committee, which is newer to the group, consists of Reverend Leslie Jones from the Truth and Destiny Covenant Ministries, and Cameron Foster, Addiction Services Council, and Mount Zion Missionary Baptist Church. The business community is also an add-on committee, and so J.B. Buzzy from Loth Holdings, LLC, and Kevin Jones from Huntington Bank are on that committee. So you can see we have got a wide array of expertise in this organization, and the beauty of HC-ARC is that we collaborate with one another and connect the dots in this community so people aren't falling through the cracks. So we've had some challenges, particularly through COVID, when it was difficult to connect with people face-to-face. And a lot of the work that happens is face-to-face, trying to save lives, get people into treatment and long-term recovery in this community. That's what we're all about. We're also trying to reduce the stigma of addiction in this community. But it's really hard to do when you can't have that face-to-face interaction with the folks that you're serving. This group, though, was very nimble and figured out ways to do virtual administering of services, which is challenging, and then get back to the face-to-face as quickly as we could. And so it has been challenging, but we've tried to do our best to be nimble. So my last comment is going to talk about this chart. Megan Gosney is the director, the ED of HC-ARC. She is so critical to the work we're doing and has brought millions of dollars into the county to address this effort. And so I want to give a special shout out to Megan, because without Megan, I don't think we would be here. And Bridget Doherty, of course, helped us put this together as well. So Megan is holding a chart, and it talks about the overdose deaths, because many of you ask about the overdose deaths and the trends. And so we've shown this in two different ways. The one on this side, the green, is the Hamilton County coroner's data when it comes to overdose deaths in Hamilton County. You can see this trend line, and so we are accurate and up to date as far as up to 2020. We're still waiting for 2021 numbers to totally come in, so that bar is likely to go up a little bit, so I don't want to, put anything out there that's not accurate. So, but what you can see here is kind of a leveling off. Now, we are talking about people's lives here, and so I don't want to lose the idea that while the trend is leveling and stable, we are losing hundreds of people in this community every year to addiction. And so I do want to emphasize that, because while we are doing better than some others, we are not in a position where we are celebrating, because we're still losing folks, and we're all trying to do more work to save those lives. This other chart is the Ohio Department of Health numbers, and so the orange shows a trend that is a statewide trend, and as you can see, there has been a significant increase related to those statewide numbers year over year in the last few years. The Hamilton County bar, I don't know if you can see it, it's in green. It is, again, showing stable numbers. The difference here is that, I'm trying not to step away from this. This one is about all the individuals that lost their lives in Hamilton County. This one is Hamilton County residents. So there are some people that are losing their lives in Hamilton County that don't live here, basically, is what the distinction is. So anyway, I draw your attention to these trends because I like to think that the work of the experts behind me is having an impact here. When we talk about some stability in the community related to overdose deaths, it's the work of the group behind me that is having that kind of impact and trying to keep those numbers down. So with that, I am going to turn it over. One last thing. We're at this location for a reason. The One Stop is functioning in this room over here. We've been doing the One Stop, where's Tom Tynan, for a few years now, and Trina. A few years now? Yes. Yeah, a few years now. And so we are now set up here, and Trina's going to talk about the One Stop, but it is a way to provide services to people that have issues with mental health, addiction, or are re-entering the community, and bringing all those services to one space so that it's easy for them to access the services. So with that, I'm going to turn it over to the Prevention Committee Chair, Nicole Schisler.
Good morning. My name is Nicole Schisler, and I am the President and CEO of Prevention First. I am the co-chair of the Prevention Committee with Leah Dennis Ellsworth, who is the Executive Director and CEO of UMADOP of Cincinnati. Prevention First and UMADOP share a common goal of providing evidence-based prevention to make our communities healthier and stronger. In 2021, the Prevention Committee worked to build awareness, engage and partner in the community, provide opportunities for individuals to decrease access of unwanted or expired medication by increasing the availability of safe storage and prescription drug disposal options. Federal, state, county, and city funds allow for a variety of evidence-based prevention strategies to be implemented in Hamilton County. Prevention First provides training and technical assistance community coalitions in Hamilton County. These coalitions serve communities within the county to reduce substance use misuse by collecting data, decreasing the access and availability of substances, and improving policy related to prevention education for youth in schools. There are 10 coalitions serving in Hamilton County: Greater New Hope Missionary Baptist Church, Step Up Anderson, Mount Washington Cares, and Cincinnati Christian College received many grants through the Hamilton County Family Services and Treatment Levy to provide effective prevention in their community. Wings of Hope in Portsmouth, Ohio is a sister program of UMADOP and a 2021 partner highlight. UMADOP provided youth leadership development and drug prevention training for their summer program in 2021 and will return in the summer of 2022. Based on outreach prevention efforts, UMADOP was awarded mental health and youth advocacy grant dollars through the City of Cincinnati to reach more youth in reducing the rate of reported suicides, misuse of substance abuse, and more importantly, the need for mental health, youth services, and community advocacy. UMADOP has continued to cast a wide net to build new school relationships with public and private charter schools, and over 300 students, teachers, and parents were provided professional development, prevention education, and counseling services. 100 building prevention with faith toolkits were distributed to churches and faith-based organizations. This resource and training are an opportunity to build relationships in the faith-based sector and multiple diverse communities and faiths. Santa Maria Community Services and the Cincinnati Drug and Poison Information Center were key partners in delivering the Prevention First training. Our Parenting for Prevention in both English and Spanish. In 2021, the State Opioid Response Dollars, or SOAR dollars, provided an opportunity to translate all of these materials to Spanish. In conclusion, substance abuse is the most effective when individuals, families, and communities come together to design and implement strategies that prevent or delay the onset of behavioral health disorders. For more information about the work of UMADOP and Prevention First, please visit our websites at cincyumadop.org and prevention-first.org. Thank you, and I will now turn it over to Neil Tillow.
Good morning. Neil Tillow at Talbert House, and I'm representing the Treatment Committee, which is really 15 treatment agencies in the community who are trying to make a real difference. And one of the big issues that the coalition really has helped address is trying to meet potential clients where they're at. Clients don't typically want to knock on a door. If you have a medical problem and it's an emergency, you go to the emergency room. If you have an addiction problem, it's an emergency, where do you go? No one really knows the answer to that. So we have to create alternate ways of getting into treatment. And so the coalition spent a lot of time thinking about that. The quick response teams that Tom Fallon is now leading has been a great example of that. The engagement center that Talbert House runs is another good example, creating a post-overdose acute treatment center. The African American Work Group is another example of that. How do we reach out to African Americans who are underrepresented in accessing treatment? And we're doing it through the church community. And so these are just some of the things that we're trying to do. So I'm going to walk through this a little bit, but I want you to keep that umbrella concept in mind that we have to meet people where they're at and try new ways of engaging people to get them in the care that they absolutely need. People with addiction and mental health problems takes 11 years from the point of their problem being identified to them actually getting treatment on average. That's national data. So this is a problem that we really have to address differently than just thinking about having an outpatient or a residential center. So we have to, all these resources are developed to create new avenues for people to get access to care. So we wanted to do three things in the treatment committee, and it's in the terrific annual report that was put together. First, we want to maximize state, local, and federal, especially federal funds. And this past year, through the Mental Health and Recovery Services Board, we brought in about $3.7 million of new funding through the strategic funding from the feds and through some other methods. And that went out to an array of organizations here in town. Greater Cincinnati Behavioral, Prevention First got money, Talbert House, First Step Home. So many of the agencies were part of this. And that was so important. The good news is that money was there. The bad news is, like with most federal money, we're not sure it's going to continue. So that's next year. So we'll see about that. We also have the African American work group. Let me talk a little about that. So John Young and Camaria Tahimbe started this up, and now we are reaching out to about 12 churches in the community, in the African American community, and we start out by developing some Narcan kits for everybody. You know, people's lives are saved every day. Yesterday we had a board meeting, and at that board meeting we talked about two of our employees saved lives of people in parking lots where they were shopping because they had a Narcan kit with them. So we want to make sure people have the Narcan kit so they can do the work they really need to do. So this has been very important, and we're now doing further outreach with those groups. The Engagement Center. As I mentioned, this is a post-overdose acute center. We get referrals from law enforcement, from the fire department, from the emergency rooms, from the QRTs, you name it. We'll take self-referrals. And these are people who've overdosed once or in some cases many times, who finally said, I want to do something different. And we bring them in and we stabilize them. Money for this comes through the SOAR money from the federal government, from the Mental Health Board, from other sources. There has been a little bit of decrease in that already. So we're starting to get concerned about how that's going to be sustainable over the long run. But last year we served almost 700 individuals at the Engagement Center. As before the Engagement Center opened, those people were out in the community and there weren't easy resources for them to access. And then finally, the Healing Communities Study. This is a large federal grant that came into the state of Ohio, and the University of Cincinnati was part of this, as was Ohio State. And they funded 26 smaller efforts in our community, showing us different ways that we could do things. So some of the Narcan funding came through them. Some of the jail-based services came through them. Some of the Hamilton County Medical Center and hospital work came through them. And for peer recovery coaches came through the healing studies. Once again, this was great resources to get, but at the end of June, that study will stop and those resources will dry off. So the message I want to leave with you today is we're trying to reach people in different ways. We just need to have the continued financial support to accomplish that. Thank you very much. And I'm going to introduce Tom Synan, the chief.
Good morning, Chief Tom Synan, co-chair of the Interdiction Committee. I'm here with my two fellow co-chairs, Trina Jackson from the Hamilton County Office of Reentry, and Chief Carstel Winston with the Cincinnati Fire Department. The Interdiction Committee is a pretty cool committee to be part of because you're talking about first responders and people that work within the criminal justice system, and we kind of have a dual role. We're working both kind of in a traditional setting of going after supply, but then you're talking about first responders, people working in the criminal justice system that said, can we do something different that makes a bigger impact? And this past year, we've seen programs expand significantly. We've seen some new initiatives, and we've seen some now what is established programs become a foundation like the One Stop Resource Center. So there's a lot of programs we're working on the interdiction committee. So I'm going to break it down and do a couple quick highlights out of each one of those. And when you're talking about law enforcement, you have to work on that supply. You have to try to reduce the impact of those deadly drugs on the street that are causing such a negative impact. And one of those is the Hamilton County Heroin Task Force. And this is a collaborative police effort working on those who supply these deadly drugs and making sure we go after them to try to make a dent in that. And you're talking about agents assigned from the Hamilton County Sheriff's Office, Cincinnati Police Department, Amberley Village Police Department, Ohio BCI&I, the Ohio State Patrol, and the Drug Enforcement Agency. And just to give you a couple highlights of what this fantastic group's doing is, unfortunately, 212 cases were initiated. That's a 15% increase from 2020. So it kind of shows you that even with all these efforts, we're still trying to make a big impact. And they've recovered some drugs in 2021. And obviously, one of the most deadly and one of the most pervasive drugs is fentanyl. They were able to take 169.04 grams of fentanyl off the street, 85.7 grams of cocaine, 75.8 grams of heroin, 130.2 grams of methamphetamine, and then what is becoming a national trend that concerns us is counterfeit pills that contain fentanyl, and they were able to take 188 tablets off of that. Now, when you're talking about getting into that non-traditional law enforcement role, how can we work on the demand side? The quick response team has really significantly transformed and expanded, and got to give a lot of credit to Tom Fallon and Megan Gosney, who have worked really hard with this, and their vision and cooperation and being able to collaborate. This is exciting stuff. So QRT is still doing its traditional reactive role, but they've also expanded into outreach, a hotspot outreach, and really working on collaborating the data. Can you build an infrastructure with the data that builds out a continuum care model? They've been working with the drug court and the African American Male Outreach Program. So you're seeing the QRT really becoming a nucleus of outreach and a nucleus of the coalition, that touch point from the front and making sure people get to active recovery. So here's some quick stats on QRT. From April 2018 through August 2021, the QRT received a total of 946 inbound referrals. More than half, 58%, or 549 individuals successfully contacted by QRT have been referred or connected to recovery support services. Of those, 66%, or 362 individuals, successfully accessed and engaged in services as evidenced by billing records from the Hamilton County Mental Health and Recovery Service Board. And you're seeing this program go from a part-time program to a full-time program, which is really exciting and allows us to really touch into them and connect pieces. I'm looking at interdiction as the link to many of the arms that we're dealing with here in the coalition. And then one of the other programs, the LEAD program, Law Enforcement Assistant Diversion Program, which again, Megan ends up being involved in everything. So Megan helps head that, and in 20 months of the pilot LEAD activity, here's some stats for them. As of February 2022, a total of 93 individuals have been referred to LEADs. 93% of those are from social contact referrals. Of the 93 referrals, 72% successfully completed an intake assessment, and of those participants who completed the intake assessment, 76% are receiving ongoing case management. And then one of the programs we've been really excited about from the Cincinnati Fire Department, this is really cool and we really appreciate their initiative on this. The Cincinnati Fire Department in January 1st, 2022 started a program that focuses on stable opioid overdose patients for potential alternative destination transport. So in other words, if someone is not willing to go to the ER, what they've done is work with the engagement center and it can be transported directly to that treatment. So one, that's fantastic, connecting someone right from an overdose to treatment if they want that. But here's the other thing that was really interesting with this, is prior to the creation of this program, many under the department had compassion fatigue. You're talking about these first responders responding to multiple overdoses, and unfortunately compassion fatigue becomes part of this. This program has really allowed them to see someone be revived and then get that help, and what has ended up happening is those that are getting help are coming back to the Cincinnati Fire Department and its members and thanking them and telling them what a difference they made. One of the new initiatives that we've been kind of working on, we just have preliminary information at the moment, is the Price Hill Hotspot program, or the Healing Communities District 3. It's kind of wrapped all into this program, but we're really focusing on a particular neighborhood, a particular community. And what we've done is focused on the high-risk individuals, 11 to 14 of those individuals. Can we wrap services around them? And we're seeing some exciting initial data that we've got to dig into a little bit deeper. Of course, Megan's involved in this too. Got to dig into a little bit deeper. But we're excited, and we believe that this program will be viable. And we're looking at Cincinnati Police and Cincinnati Fire Department to expand on the resources and help us with that. And then why we're all here and where we're at is, I know I had a lot. So I even broke it down. I highlighted little sentences. The One Stop Resource Center, which is what we're all here in the vision of Trina Jackson. The initiative launched on the final Friday of September 2019 with 134 participants attending in September and October. And then in September 2021, it moved to this venue here, the Duke Energy Convention Center. A total of 276 residents of Hamilton County have come to the One Stop Resource Center in that 6-month period. And what it's really working on is, can we bring the resources to the people, not just a pamphlet, but you'll start getting services right off the spot. And that's what the One Stop Resource Center is. And hopefully you all get a chance to check it out. It's a fantastic program. I tried my best. And I want to introduce Dr. Mooney.
Thank you. Good morning. Chief Synan is always a tough act to follow. I will do my best to have the same excitement and try to control myself with my excitement, because harm reduction has been incredibly super powerful this past year. And it's really interesting to hear all of these other folks talk about sort of the lanes that they're in. But I will tell you, the longer and longer we continue to connect, the more those lanes continue to blur together. And I think that what's really, really exciting is that we aren't just siloed, right? We are all working together. We're seeing people at different parts of their lives so that we're giving this sort of comprehensive effect and hand-holding and hand up. I think one of the most interesting things in the beginning, when we first started getting some really serious funding in public health to address the addiction crisis, it came from the CDC, $5.3 million per year, going toward efforts to look at surveillance and prevention on how we can really reverse this opioid crisis. We used to say that we were program rich and system poor. So things were out there, but they weren't really working together. And it's really hard for people to navigate those things. So over the past year, really, the goals to save lives and keep communities healthy have led to like extremely massive growth in our harm reduction efforts. To put it frankly, harm reduction is a principle. It's a philosophy. Harm reduction basically means we're putting forth practical strategies every day to reduce and mitigate the negative effects of drug use. So whether that's for a community or for an individual, harm reduction, that's in every bit of that wheelhouse. This past year, we've really expanded kind of beyond and above what you all have typically seen from harm reduction, which is usually couched in syringe services and Narcan distribution. This past year, we've worked to create a multidisciplinary subcommittee composed of many of these members with all sectors. So looking at it as a sort of a hub and spoke model where we've got housing, we've got recovery housing, we've got food, we've got job security, workforce development, harm reduction, public health is just one cog on that wheel. So really looking at it as saying multi-sector, multidisciplinary approach to how we're going to address this. So this has led to an additional focus on reducing stigma and addressing access barriers. And while they're unable to attend today, they are co-chaired with Linda Gallagher of the Mental Health Recovery Services Board and Tiffany Mattingly of the Health Collaborative. In addition, Hamilton County Public Health has expanded access to harm reduction supplies. We are rebranding and reframing our narrative to call ourselves Safe Services, stigma-free access for everyone. This allows us to tap into people that we have not been able to reach in the past, and we know the data is showing the other people are affected, people of color, minority populations, people that we have typically not served in the past. So this is allowing us to really focus and expand our efforts. We've actually increased our Safe Services mobile location +1 this year to include Walnut Hills, specifically to do targeted outreach for African American Black population. Our service is expanded to offer fentanyl test strips. As we know, fentanyl is present in essentially every illicit substance these days. We continue to offer Narcan, safe injection equipment, referral for treatment, and HIV and hepatitis C testing, all in effort to meet people where they are. Public health has grown in numbers. I'm extremely proud of this. With our own staff, we started with 3 full-time people at Hamilton County Public Health dedicated to harm reduction. We are now 15 strong. And many of those folks are people with lived experience, certified peers. They're out there. They're doing the boots on the ground work. They're engaging. It's so exciting to see this in government. This is unprecedented. So I think we can continue to move that needle and continue to change the way that this is framed, including people with lived experience is an untapped resource. So, as always in public health, we continue to listen to and follow the data in our efforts. Our surveillance team has also grown. We have 4 epidemiologists dedicated to injury surveillance. We have real-time dashboards, continue to explore new ways to measure successes and innovations. So COVID has really taught us that compassion wins, right? Rather than judgment. And I think the more and more we continue to have these conversations around harm reduction, and it's not stigmatizing, it's good. It's good. We should meet people where they are, give them the opportunity to find their way forward into probably crossing into some of these other sectors that we're hearing about today. So I'm very excited, and if you ever want to know anything else, please reach out to us. Just go to hcph.org and reach out to contact us. And if you want to get involved, please do the same. So I'll turn it over to Cameron.
Thank you. My name is Cameron Foster. I'm from the Mount Zion Missionary Baptist Church and work at the Addiction Services Council, co-chair of the Faith Committee, along with Pastor Leslie Jones of Truth and Destiny Covenant Ministries. Recovery encompasses a whole life, including mind, body, and spirit. Community life for many, faith is critical to their recovery. The faith community helps the coalition raise awareness and use their compassion and local understanding to bring hope and healing to those in need. Their faith community also works with the African American Engagement Work Group, which has now launched the effort throughout the African American churches. There's 10 churches where the Faith African American Engagement Work Group is doing programs and things of that nature to raise awareness around addiction. And they go in and we work with the congregation. First, we get contact with the pastor. Pastor gets us on board that we can stand in front of their congregation, announce the initiatives that's coming to their churches and the congregation, engage in the congregation and the treatment and prevention efforts, educate them on the hot spots and things of that nature. We also have the opiate fentanyl test strips and the Narcan at the churches. The other part of it, we're community-wide and we're new, so we're new to the team, and I'm new to being the co-chair. So, but the other pieces of working with the churches is a key because that's sometimes the gateway into the community. A lot of times people will come to the church when no one's there, and so now we want to educate someone at the church where you could call this number or go have someone come to the church and pick that person up to get them to the services that they're needed in the community. So it's a vital piece of this committee. Looking forward to working more with the committee. Also, you have to look at over the years' time, churches was a closed place, but now with everything's going on in the community, doors are opening wide, eyes are opening, the ears are opening, the hearts are opening, and softening to the addiction piece and the stigma of addiction. So we look forward to working with the churches throughout Hamilton County and greater Cincinnati area. So we're new. We don't have a lot to report on, but we have the passion to work within the community at this time. I'm going to turn it over to Kevin at this point.
Thank you, Cameron. Good morning. My name is Kevin Jones. I co-chair the Business Community Committee with J.B. Buzzy. We are honored to be partnered with these folks in trying to address the addiction recovery and challenges that are being faced here in Hamilton County. The Business Committee has deliberated and analyzed over the past year to develop strategies to help businesses utilize their resources, expertise, and networks to create workplace and community solutions to combat the addiction crisis. The committee has drafted and published these strategies and findings together in a business response toolkit. The committee continues to recruit members and identify business leaders who will set the tone and make it a priority for their company and employees to understand substance use disorders and addiction and its impact, and bring resources and awareness to those facing addiction. So far, we have identified 20-plus businesses and their leaders throughout the region in this process. We look forward to continuing to partner with Hamilton County Public Health to help pilot the Recovery-Friendly Workplace Initiative and to reduce the stigma of in the workplace of addiction. I also want to thank the Cincinnati Regional Business Committee and the Greater Cincinnati Chamber's Workforce Innovation Center for their partnership in helping this recovery. With that, I turn it back to Commissioner Driehaus.
All right, well, there you go. There's the annual report. As you can see, there's a lot going on, and it's all good stuff, and these folks are experts in their fields. So I cannot express the gratitude that I feel to them allowing me to chair this committee. So with that, we're going to turn to any questions you all have. Yes. Yes, I purposely left that off because it can be very complicated, but let me try to put it in a nutshell. So there is money coming because we sued the distributors, so it's called the opioid settlement, and it's coming in different tranches. The state's going to get a percentage, the local jurisdictions are going to get a percentage, and then a percentage will go into a foundation. So the local money is actually coming first, and so the city of Cincinnati, Hamilton County, there are 49 jurisdictions in Hamilton County. Some of them are large enough to get some direct allocation from that. The foundation money is coming a little bit later, and so we are in the process of forming a foundation board, which we are required to do, to represent us at the state level and also to make recommendations about how that money should be distributed. And so that is a work in progress. We're very close to finishing that up. We've reached out to all 49 jurisdictions to get their buy-in. I'm leading the effort with the county administrator. So more to come on that front, but it is a lot of money, and these folks on HC ARC will be in an advisory capacity to all things related to those dollars, because as you can see, the expertise lies right here.
Well, I think the treatment community, where we deal with clients face-to-face, has struggled quite a bit. Actually, many agencies went to a hybrid model that worked pretty well. So we would have some clients who came in and were socially distanced and masked, and other clients who were on the screen calling in through a Teams or Zoom application and participated in treatment groups that way. And at first it was a little bumpy, but over time it got very nice. And some clients actually prefer the virtual access now. About 35% of our clients prefer virtual versus face-to-face. So while it pushed us into doing it, we went from 2% virtual to 95% virtual in 2 weeks in March of 2020. And so now it's down to about 35%. So most people have migrated back, but that's what you had to learn how to do something different, because clients still needed the care. We just couldn't do it face-to-face right away or immediately. But over time, we got to learn how to social distance, how to clean things, and by the way, I have to say that the county, through their emergency management agency, has been awesome to the drug and alcohol mental health community in providing PPE on an ongoing basis so that we can continue to deliver those services.
Well, look, fentanyl is the biggest issue we face, and that started hitting the streets in 2012. We saw it a little bit, but then 2014-15, we saw it start rising significantly. And at 2015-16, and especially going into 2017, Cincinnati, unfortunately, was one of the first cities in the United States to see carfentanil. And you're talking about nearly 200 overdoses in 1 week. There were times that there was 70 overdoses in one weekend. It was significant. So 2017 was a major influx of fentanyl and overdoses. And when you're talking about 4 or 5 runs a day, there was times Cincinnati Police and Cincinnati Fire were responding to 40 overdoses in a single day. That was not unique to this area. 2017 was and you can see it in the chart, no matter if we're looking at the state ODH numbers or the preliminary numbers for Hamilton County and the final numbers from the coroner's office, you can see 2017 was significant. That wasn't just here, though. That was across the United States. And what we've seen here, and Commissioner Driehaus talked about this, is because of this group, and here's the thing, this group started with about a dozen people, and now you're talking about 350 individuals, 137 separate agencies that are working together, and that's where you see the stabilization. So unfortunately, we still see close to 50 to 70 overdoses a week, but what we're trying to do is stabilize those deaths. So the introduction of fentanyl in 2012, especially going into, you see it here, the 15, 16, and 17 years, made a significant increase. But because of the work of this group, because of the education out there, because of Narcan on the street, the first responders, we've been able to stabilize. So fentanyl is the issue. If it was not for fentanyl, we would not be in an overdose crisis. If it was not for fentanyl, the programs that you see here would actually fulfill their highest potential. So fentanyl ends up being the biggest hurdle. Did that answer? Yep. You know, when I was growing up, they would say the first time you use drugs, you could die. It probably wasn't necessarily true. It was more of a scare tactic. I would say with the introduction of fentanyl, it's the first time in U.S. history where the first time you use, you could literally die. You're seeing fentanyl pretty much become a staple in the drug supply. And it is in methamphetamine, cocaine, heroin, crack cocaine, and these prescription pills. The United States really got tough on China, and China's not making necessarily the fentanyl itself, but the precursors, and then sending it to the Mexican cartels. The Mexican cartels are really significantly pushing the methamphetamine and the prescription pills. So here's the warning, and what the DEA is talking about. If you are not getting your prescription medication from a doctor or a pharmacist, you are in danger. If you're buying it on the street, you do not know what's in there. Now, some people are using fentanyl with other drugs, but sometimes people don't know that fentanyl is in that drug. And if you're buying a drug from somebody on the street, I'm telling you, that person doesn't care about you. They're not a doctor, scientist, or pharmacist. They're worried about the money. And if you're buying a prescription pill off the internet or off the street, it could be deadly. So you have to be careful with that. So from a parent standpoint, you don't want to scare people, but I think we do need to be cautious with this, and I think we need to be alert. And when I get phone calls from parents, I tell them, monitor your kids' activity on their cell phones, on social media, TikTok, and also the internet. And be careful and know the signs of what addiction is and what an overdose is. And one of the things that the health department has really worked on in the messaging is make sure if you're going to use, you don't use alone. I know it's weird hearing that from a cop and this group of people standing here, but really we see that saves people's lives. When someone uses with somebody and they are Narcan, it gives us an opportunity to get the outreach out to them.
So something that the chief just mentioned is we're seeing an ever-increasing presence of methamphetamine and cocaine-related overdoses, overdose-related deaths. So our IP team is actually tracking data on the type of substance found in a decedent, and we're seeing more and more of that, which means we're tapping into communities that we didn't have on the radar, right? Specifically for overdose and overdose death. If you look at the 2020 to 2021 overdose increase rate, 33% increase among African Americans. So the data doesn't lie, and we're putting together little pieces of the data to tell one big story. But I think that that's why you're seeing a lot of mobilization of these resources is like, whoa, we have real-time data that's showing something is going on. We have to be real-time in our response.
One more back there behind you.
While you're really talking about ultimate harm reduction, right? And I think that what you'll see is there's a lot of gray as far as how people want to define what harm reduction is. clearly there needs to be political will to establish these kinds of efforts. I think what we're doing is walking trepidatiously on the political will that we have now to operate in such a way we do. We're fortunate here, fortunate to have a robust syringe services program. We are fortunate to have as much Narcan we do in the community, and we're able to monitor how effective that Narcan in the community is actually on overdoses. I do think that that could be a potential. I don't think it's anywhere in the conversations at the moment, but I think listening to the science and the data that comes out of the sites that are already established here in the U.S. would be really instrumental in that. So.
All right, great. Thank you. And I want to speak for the group and say thank you all for being here, and we're all available for interviews afterwards. Thank you so much.